My name is Gina Damp, and I'm one of the pre-lung transplant nurse coordinators for the lung transplant program, and I will be reviewing the pre-lung transplant evaluation process. At the conclusion of the video, you'll be able to describe the lung transplant evaluation process and requirements, discuss the importance of mobility and staying active, access the lung transplant patient and family education videos, identify your key contacts for communication and questions during the evaluation process, and lastly, explain the decision-making process for transplant candidacy decisions. So the evaluation. The evaluation consists of an inpatient evaluation, which is an overnight inpatient stay at the hospital, which is about 32 hours in total from admission to discharge, as well as some consults. The overnight admission is overseen by a transplant surgery physician assistant who will be in charge of talking with you through the overnight stay, managing your tests, and making sure that everything is done during that overnight stay. You will have a series of lab panel testing for transplant, which includes things like electrolytes, blood counts, and also a series of infectious disease labs, which are done in order to determine if you have been exposed to any infectious diseases that may lie dormant within your system, or infectious diseases that may need to be treated prior to potential transplant. You will have a series of other testing, which includes esophageal manometry, which is an evaluation of the esophagus muscle to determine whether or not you have any concerns related to reflux and abnormal movement of your esophagus, which is important for evaluation to determine if there is any management of reflux or any surgical procedures to fix reflux that might be needed pre-transplant or post-transplant. You'll have a series of imaging for your heart and lungs, which will include a heart catheterization, which is done under conscious sedation, and a wire is threaded into your heart in order to look at the pressures and to see if there's any coronary artery disease present in your heart. You will have an echocardiogram, which assesses the valves of your heart and the motion, as well as the pumping of your heart. You have a chest CT and X-ray, which will look at the size of your lungs as well as the anatomy of your lungs. A ventilation and perfusion scan, which tells us how well air is flowing through your lungs and how well blood is flowing through your lungs. You will have pulmonary function testing. You will have a 6-minute walk test, which is critical to the evaluation process. You must be able to walk a minimum of 650 feet in 6 minutes. Mobility is a major part of the evaluation process because it can tell us how well you will do with recovering post-transplant. You will also have abdominal imaging to look at the other organs in your abdomen to make sure that there is no abnormalities or further testing that we may need to evaluate on something like your kidneys. The consults will also be done as part of your evaluation, which includes a nutrition evaluation to assess your eating habits, give you an introduction to transplant nutrition, and to make sure that you have a healthy body weight. A social work consult. For this consult, you must have your 3 support team members present with you. The support team is critical to the evaluation and transplant process, as they will be there to help you get through your evaluation and testing, engage in education that is critical to understanding the transplant process, and helping provide care in the home. You also may have a psychiatry consult. The purpose of the psychiatry consult is to determine if someone has any psychological history, such as anxiety, depression, or other diagnoses, and to evaluate a person's ability to cope with the transplant process and engage in the transplant testing and needs with post-transplant care. You will have a neuropsychiatry consult as part of your evaluation if you are 65 or older, as this is testing for your cognitive, memory, and behavioral function. It is important to have this consult as it will determine a person's ability to engage in all of their transplant needs, remember their daily medications, and follow-up care. Additional consults may be required as part of the evaluation process, dependent on a person's lung diagnosis, history, and the results as they come in. Once you have your inpatient evaluation and consults, you will be scheduled with a thoracic surgeon so that you can have a surgical assessment to determine your ability to go through the actual procedure and also to review your tests and consults that you have completed so far in your evaluation and to get feedback regarding any issues or concerns. It's important to note that the evaluation process at Brigham and Women's will be done at our hospital, and virtual visits will be a rare exception so that we have access to all your testing and can make adequate decisions based on the information available to us. The other component of your evaluation is the outpatient testing, which is all of your routine health care that needs to be up to date as part of your overall candidacy decision. This testing will be done through your primary care physician, as some of these tests may be up to date or they may need to be scheduled locally for evaluation. The first part of the testing would be the cancer screening for men and women, such as colonoscopy, mammogram, pap smear, and prostate exams or testing dependent on a male's history of prostate disease. It's important to have cancer screening, as post-transplant, you are given immune suppression to ensure that your lungs remain healthy. However, when the immune system is depressed, you are susceptible to other things like infection or the growth of other diseases such as cancer. So it's important to have clear cancer screening prior to transplant to reduce those risks. You'll also need a bone health screen, which is done by a bone density exam called a DEXA scan, to assess if you have any reduced bone health or osteoporosis. The reasoning for this is because immune suppression also does lower your bone strength post-transplant, and you will have immune suppression lifelong. We need a baseline screen of bone health in order to determine if you might need any supplemental medication or treatment for reduced bone health, and to ensure that you won't have fractures post-transplant. You will also have a dental screen. Dental screen is for the purpose of ruling out any oral cancer, as well as any significant infections that you may have that will need to be addressed prior to transplant. So if you have any dental work, infections, extractions, or any serious dental work that needs to be done per your dentist, this will need to be completed before you can be considered a candidate for transplant to reduce your risks of developing any cancer or infections post-transplant. Lastly, you will need to make sure that all your age-appropriate immunizations are up to date. This is including things like your pneumonia vaccines, flu vaccines, all of the COVID vaccines, which includes the primary vaccines and the most recent bivalent booster, tetanus vaccines, the hepatitis vaccines, measles, mumps, and rubella, HPV dependent on your age, and shingles dependent on your age. It is important to have your immunizations up to date, as we need to make sure that we can provide protection against any well-known viruses prior to transplant to reduce your risks post-transplant, as post-transplant patients are highly susceptible to viruses and infections. It is important to note that you as a patient are responsible for making sure that your routine health maintenance is up to date and remains up to date, and that these tests are sent to your nurse coordinator. Please feel free to call your nurse coordinator if you are unsure if he or she has received any of your information. Things to avoid during the evaluation. There are substances that are absolutely prohibited while undergoing the evaluation process. First, you cannot use any inhaled substances of any kind, as you have a lung disease and we do not want a patient to inhale any further substances that might contribute to lung disease or cause an area of concern during the evaluation process. Secondly, tobacco. Tobacco is absolutely prohibited in any form for evaluation and moving forward during this process. This includes things like nicotine patches, Nicorette gum, or any inhaled substances. We will test you throughout the process for nicotine exposure. So you want to make sure that you are not ingesting any nicotine, and you stay away from anybody who may be smoking around you, as if your results are positive, we will be unable to determine where the source of the nicotine came from, and this may be a cause of concern and stop your evaluation. Alcohol should be stopped during the evaluation, and it is absolutely prohibited once a person is accepted for listing and placed on the transplant list. Alcohol use comes with various health concerns. However, it can also be a source of delirium postoperatively if there is continued use. Marijuana and THC products are also prohibited unless there is a medical card for a medical reason or use of the product. It can never be inhaled, as I mentioned before regarding inhaled products. However, it can be used via edible form or topical form as long as you have a medical indication for its use and can provide documentation of that medical need. Also important to note that THC will not be able to be used post-transplant should you be a candidate for transplant, as it can affect post-transplant medications. Over-the-counter or prescribed medications to avoid. Narcotic pain medications are prohibited pre-transplant for long-term use due to their effects with respiratory depression, reducing your ability to adequately breathe. Also due to its potential for causing post-transplant delirium in the operative setting, as well as the possibility of a person having inadequate pain control post-transplant due to tolerance for the medications. Other medications to avoid are non-steroidal anti-inflammatory drugs, also known as NSAIDs, which are over-the-counter pain-relieving drugs, such as ibuprofen, naproxen, Pamprin, or Celebrex. These medications are prohibited as they can cause negative effects on the kidneys, and they can predispose you to post-transplant kidney dysfunction, which we want to avoid. Herbal pills and supplements. Many of these pills that you can obtain over the counter severely affect prescribed medication drug levels, and it is prohibited. It's important to note that you must comply with the avoidance of these prohibited substances. If you are unable to do so, it may contribute to a 6-month probation from our program, in which we will have to pause the evaluation until a person has been able to prove that they have stopped these substances, or it may disqualify you from our program as a candidate. Mobility is a very important part of the transplant process and post-transplant process. As a pre-transplant potential transplant candidate, you will need to be enrolled in a pulmonary rehab program. You can discuss a pulmonary rehab program with your pulmonologist to refer you to a location that is convenient and local to you. Upon completion of the pulmonary rehab program, you will need to continue to engage in an exercise program if available. Sometimes pulmonary rehab programs will have a maintenance program for you to continue with if insurance applies. You will need to exercise for a minimum of 5 days a week, 30 minutes a day, whether or not you need to split that exercise in the day with maybe 15 more minutes in the morning and 15 minutes at night, as long as you are continuously exercising and moving your body. Why is it so important? Because in order to maintain candidacy for transplant, you need to always be able to pass a 6-minute walk test of 650 feet for the evaluation process and as far as up to transplant. Mobility directly is related to post-transplant course, and you need to be able to get up and use your lungs immediately post-transplant. And you will be walking the hallways post-transplant several times a day in order to use your new lungs. It can also contribute to whether or not you are discharged home or discharged to a rehab facility to gain further strength in order to go home safely and get around your home. I have this slide here of a quote, "Knowledge has a beginning but no end." And this is an important thing to keep in mind, as throughout the evaluation process all the way through post-transplant, education will always be important for your outcome, for your knowledge, and for your ability to cope through the process and communicate with your team. Transplant knowledge is for both the patient and their supports, and it is vital to go through the transplant process. The more you know, the better you will be in the post-transplant post-operative period. Please make sure that you are reading your transplant manual and that your supports are reading the transplant manual. Your supports are there to help you throughout this journey, both pre-transplant and post-transplant. It is important for your supports to know when you may need help or assistance, when to communicate with the team, and what needs you may have post-operative so that they can support you when you are unable to do things independently on your own. There's a series of education beyond the transplant manual on our website. You can go to the Lung Transplant Program website and go to the Support and Resources page to look at various videos of education that has been provided over time. There is also a monthly support group that meets virtually that we encourage for all of our patients and their supports to attend, as each session covers an educational topic for pre and post-transplant patients to engage in. It's important to know your key contacts during the evaluation process. Pre-transplant patients going under evaluation are still managed by their primary care physician and their pulmonologist. So it's important that if you need any prescriptions or have any concerns or develop sickness while going through this process, that you are communicating with your primary care physician and your pulmonologist. It is important, however, to also keep your nurse coordinator in the loop so that we can make sure that if there is any testing or additional information we need as far as your transplant candidacy, that we can address it. If you have any clinical updates, questions, or concern, your main contact for the lung transplant program is your nurse coordinator. The nurse coordinator is available Monday through Friday during normal business hours. You can also send a patient gateway message to a nurse, but please note that patient gateway messages are not used for urgent needs. And if there is an urgent need that you need to have addressed, please call your nurse coordinator. For scheduling and appointments, you want to contact your pre-transplant administrative coordinators and they can assist you with that process. Please refer to your transplant manual for the contact information for various members of the program. The Transplant Selection Committee, how candidacy decisions are made for transplant. So we have the Transplant Selection Committee, which is comprised of the physicians, surgeons, and various consult services that you meet throughout the process, such as social work, nutrition, and psychiatry. You'll also have your nurses there, financial coordinators, and nurse practitioners. Our Transplant Selection Committee meets weekly to review candidate information to determine if someone is a candidate for transplant. We will review all of the information from the tests and procedures and labs that were completed during your evaluation process. It's important to know that during this process, there is no one team member who will make a decision regarding your candidacy. Candidacy decisions are based on your information and are made as a team. The possible outcomes that can occur once the team has reviewed your decision are the following. You can be accepted, meaning that you have been approved and you will be placed on the transplant list. You can be deferred, meaning that despite all of the information that we have done during the evaluation process, the team unfortunately still cannot make a decision regarding your candidacy, and you may need a lab, consult, or further testing to make this determination. Lastly, a person may be denied. Once a decision regarding your candidacy is made, a patient will be reached via telephone of the decision by either a nurse or a physician. If there are further questions or a patient would like to have a visit with a physician after this phone call, we can help arrange that for you. Please note that although we have a patient go through the evaluation and we do come to a conclusion, a patient's candidacy can change at any time throughout the process. It's important to know that a person's candidacy can change at any time. If there is a change, such as a change in your heart or kidney function during the evaluation, we will further assess it through testing. But unfortunately, sometimes these changes can happen as a person declines in their condition, and it may change a candidacy decision from accepted to no longer a candidate for transplant. In conclusion, the goal of your evaluation is to work with your coordinator to complete the transplant evaluation in a timely manner and to give the patient a candidacy decision. It is very important to actively engage in education. Active engagement and education by the patient and their supports is an important element of the transplant process. You must stay active and enroll in pulmonary rehab programs in order to remain active and strong going into transplant. Please reach out to your key contacts in the transplant program for clarification of questions or any concerns throughout the process. We are here to make the transplant process as smooth as possible and provide you support. Thank you.